Fellow caregivers, today we recognize Founders Day and the culmination of our centennial year. Thank you for celebrating our 100th birthday with so much pride. Cleveland Clinic will always honor the past. We do so to learn the meaning of our traditions and understand where we're going. Since 1921, our mission guides us to do more good as a team. It is what our founders intended when they introduced the pioneering model of care. Years from now, I hope that you also cherish your service with fellow caregivers. In time, those who come next will be celebrating you and honoring all of the good that you achieved. Soon, you will stand with the best parts of our history. We are preserving 100 years of care on a plaque at our main campus. It will hang alongside a plaque dedicated to our founders in 1941, which we are restoring. We will then bury a time capsule to be opened by caregivers 50 years from now. The capsule will contain artifacts that depict our battle against COVID-19 and messages from today's caregivers. Now it is my privilege to welcome past and present leaders to say a few words.
It's been more than 50 years since I was chairman of the Cleveland Clinic. In the 1970s and 80s, we had the largest expansion to date here in Cleveland on the main campus and also at Florida. What's happened to the clinic in terms of growth since then is simply spectacular. Most impressive is the fact that you've maintained the clinic's legacy for excellence in healthcare. Congratulations, and thank you for your service.
Cleveland Clinic has always been known for innovation. As I look to the next 100 years, I see advancing care for patients everywhere through research and new technologies. I could not be more proud of what our caregivers have achieved and where you are going. Thank you for putting patients first.
For over 100 years, patients have been choosing the Cleveland Clinic for their care because they know it will be safe, with a quality outcome and a great experience. It's because of you, our Cleveland Clinic caregivers. And in the next 100 years, I have no doubt that Cleveland Clinic will become the best place for care in the world and the best place to work in healthcare. So thank you for everything that you do to fulfill our mission.
When I think about the future, I imagine how we are shaping it right now. Patients will become our lifelong partners in care with access to us anywhere they are. As caregivers, we will care for each other in all aspects of well-being, making this the best place to work. Through our partnerships and investments, our communities will become the healthiest in the world. Finally, the organization will grow to touch every life that could benefit from the best care possible. Thank you for supporting our shared vision of what's to come. As we end our centennial, let's hear from the next generation of caregivers and what they see on the horizon.
When I envision the future of medicine, I think the pandemic really highlighted what work we still have to do and increasing access to healthcare in our community and fighting for global health equity as well.
We are going to provide high-class services to our people, not only in the UAE, but regionally. It's a home for hope for everyone.
To expand and reach more throughout all of Canada would be very exciting. What is it that they need, and how can we adapt and pivot to meet exactly those needs?
As a medical student at the Cleveland Clinic Lerner College of Medicine, I have had the opportunity to be part of this incredibly innovative medical education program. This idea of being open-minded, whether it's in education or biomedical innovations, is just a really great attitude to have for the next generation of patient care.
I've been a nurse now for a little over 3 months, and I've seen things in these 3 months that I didn't even know existed. The world is our oyster right now for how technology is going to advance, and we're advancing quickly.
Working here at Cleveland Clinic, Nevada is really special to me. We moved out here for my grandfather who has a neurodegenerative disease. So I hope that in the future we can expand education and then even finding a cure.
So my hope for nurses, especially here in Florida, is that we start to work more at the top of our licensure. That's going to be the way of the future for nurses, being more specialized, higher level of care, higher decision-making capacity.
It's really incredibly exciting to have the Cleveland Clinic here in London, to be part of a global organization that is really at the forefront of healthcare to deliver the novel therapeutics, new technologies for our patients.